The U.S. military has historically been male-dominated, but women have made contributions since the American Revolution. However, it was exactly 100 years ago that women veterans were first offered health care through the Department of Veterans Affairs, also known as the VA. Although the VA health care has come a long way since 1923, women veterans I spoke with say more is needed to address their unique needs and challenges. Jessica Mayfield served in the U.S. Army Reserve for 22 years. She remembers a VA visit during her early years of service.
I cannot tell you how many times I got stopped in the hallway to say, who are you here to visit? Who are you seeing? Didn't occur to anybody at that time, 20 years ago, that I was actually the patient.
Today, Mayfield is more than recognized in the VA hallways. She's a nurse practitioner who is offering health care and serving her fellow women veterans.
It's very easy to get a referral. A lot of people think that it's difficult and it's a long process, and how long is it going to be before I receive care, which has been a long-standing stigma of the VA. Fortunately, we've come very far.
Amy Diaz started her U.S. Army career as a supply specialist. She, like Mayfield, turned to nursing after retirement, providing the special care women veterans need.
We want to be able to have access to primary care and also women's services for like gynecological needs and even mammography.
Another unique care the VA offers, one that's hard to talk about, is sexual assault. Last year, almost 9,000 sexual assaults were reported within the military, with more than 7,000 of those reports occurring to people actively serving. Navy Reservist Susan May speaks about sexual assault because she is a sexual assault survivor. Although she reported her attack by another military member, Mays understands why assaulted military women don't say a word.
There's kind of a blind eye to it. They don't want to admit that it happens, and probably as often as it happens. It's more common than what they want to believe it is.
Mays didn't get the legal justice she wanted and admits she didn't seek the health care she needed.
My reserve time was over in 91, 92. It didn't come until 2012 before I started to actually deal with the military sexual trauma.
Now, as a medical support assistant, Mays makes it her mission to support sexual assault survivors who seek help at the VA.
It does help to have that someone to talk to and to get it out as much as it hurts and as painful as it is. It does help.
The efforts of Mays, Diaz, and Mayfield highlight decades of determination to tailor VA healthcare to the needs and experiences of women veterans. If you missed part 1 of this series, you can hear from all 6 of the women veterans we spoke with on We Are Iowa Plus.